Hey guys, my name is Sheena and I'm going to walk you through the steps on how you can access the patient portal for health services and go ahead and fill out all of the health forms. So from the UNA website, the easiest way to get to health services webpage is to go through the quick links, and under safety and wellness you can scroll down and click health services. Once you come to this page, this is going to be our web page, and there are several different quick links here. Our available services, the immunization requirements from MedProctor that you should have completed. You can meet the staff, and then the patient portal. When you click there on the patient portal, it is going to bring up the UNA portal, and you will enter your UNA username and password. Once you do that, it's going to click over to a form that looks just like this. You have any upcoming appointments that you've got scheduled with the clinic, the forms tab here, and then you've got statements over here. And this is where all of your receipts from when you come to the clinic, all of those are going to be located here. Sometimes our staff sends messages like class excuses here in the message link. So you would log in here so that you can access those and send those directly to your instructors. So today we're going to go into the forms, and we're going to look there, and there are several forms on here, but the ones that you need to fill out have the red asterisk beside them. Those are the ones that are required for you. So if you have not filled those forms out when you come to the clinic for an appointment, you're going to have to fill those forms out. So first, let's start with the release of authorization. This basically gives UNA and health services um, the ability to release information if we needed to call to get information from another doctor's office, if we needed to get in touch with you, if we needed to speak with someone other than you, who would we speak with? So everything on here with a red asterisk has to be answered. So I authorize health services to release or obtain my information, and you can click yes or no. May we leave a message on your answering machine, on your cell phone? May we send it to your mailing address? May we email you? Um, may we leave it with a family or friend? If you click yes, then you would need to enter who and then their telephone number. If we can we contact your place of employment? May we discuss treatment with a parent or guardian? That's always a hot topic. So if you do want to give us permission to speak with a parent or guardian, if you're sick and they want to call and check on you, we can look here and we can say, oh, your name is, you're listed on here. We are happy to talk with you. And then by typing your name, here in the blank, that is your signature, and you can submit that. Okay, one form down, two to go. The next one is a UNA privacy policy agreement. And we have the privacy policies on our website. Right here at the bottom. So that is our privacy agreement. So you can read that. And then once you read that, you're going to type in your full name again, saying that you are signing this document and that you have received that and you acknowledge the things that are listed there on that privacy policy. The next form I think is the most important form. It's a form that has to be updated yearly, and this is really important, especially for the incoming students, maybe those that are coming straight from high school that have never filled out a medical history form before. So being able to sit down with a parent or guardian and go through this information so that the parents and guardians that are out there maybe listening to this can go over this information with your student and sort of teach them things that maybe they didn't know what it was or didn't know that they may be allergic to a certain medication. It's really important that we know what medication students are allergic to. So, yes, we want to know what you're allergic to. You can type that in. And then maybe you're allergic to several things. You can type all of those in here. Do you take any regular medication? That's really important also because we need to know if maybe you're taking birth control. We need to know if you're taking a medication that would require a refill. Maybe you have an albuterol inhaler. And so all of that information is really good. It's already on here, and so our nurses can reference this back if needed when you come into the clinic. You currently have medical insurance. If you do, just yes or no. We do not file insurance at the clinic, but that information is very important for us to know if we needed to refer you somewhere else, because those people will file your insurance. And so that actually, this information crosses over into our electronic medical record. Have you had any surgeries or hospitalizations? And you can list those out here. You've had an oral surgery and maybe you've had your tonsils taken out. And if you know the dates, you can add those in there as well. Do you currently smoke or use tobacco? Yes. And you would put how much? 1 pack per day. Do you currently use e-cigarettes or vape? You can, yes or no. Do you drink alcohol? Personal history. Do you personally have your student, or do you personally have any of these diagnoses? So I'm just going to go down through here and mark some that we may have. And then family history. This is important because we're talking about immediate family. So mom, dad, brother, or sister. Do any of them have these medical conditions, or have they ever been diagnosed with these medical conditions? And so if so, and then we would just ask you to put on here which person in your family had been diagnosed with these. And then I understand that by electronically signing this form, everything is true and accurate. And then you're going to type in your name again and your L number, which is on your main card. And you can just type that in. And it already has the date there, so you will just click submit. And you are good on the forms. So there are no forms here that have a red asterisk beside them. Now, we'll just go over these forms very quickly. There's a flu vaccine consent form on here. So every fall, every student and employee at UNA gets a free flu vaccine. So if you'll go ahead and fill that out, then we'll go ahead and we can get that in the computer system. And your copy will actually be here in the messages. You can actually go in there and print that, or you can send that to a job if you needed it for a job. You could send it to your parents for verification that you did in fact get your flu shot. And then we also have STI testing consent. We do sexually transmitted infection tests. Each student on campus gets a free test each semester. So one free test in the fall, one free test in the spring. So you can fill that consent form out there if you need to have that test done. Also, if you are an athlete, or maybe you are involved in another activity on campus like band, cheer, dance, anything that requires you to have a physical, this is the form here that you will fill out before you come into the clinic. And once you come into the clinic, we will finish filling that form out, but that's where you would do your part there. Also, if you needed a physical for a job, that also is a form that you would need to fill out before you come in. And then we have the women's health form here, and that health form, we require that to be filled out yearly for anyone that comes in requesting birth control, anyone that's having any sort of women's health problems that needs to be seen, or just a checkup. That form there, we require for you to have that filled out each year. Also, there's a spot in here where you can actually add insurances in here if you want to. There's several company names that are already pre-listed in here, so you can find those very easily and enter your information. This is very important. Again, I just want to reiterate that we do not file insurance. However, we will need this information if you're a student or you needed to be referred somewhere else. And so this information crosses over into our electronic health record. It's really good to have the information in there just so that we can go ahead and give it to the doctor that we're referring to right when we're sending the referral over. Another up here at the top across the toolbar is education. Our nurse practitioners and doctor providers always like to send some education about whatever your diagnosis is or whatever that you're seen for there in the clinic. And so all of your discharge instructions will be listed under here. And then also any statements, like I said, where you come to the clinic and maybe you get an antibiotic and it's cost you $5, then your receipt will be there under statements. So this patient portal is really good information, just kind of like a one-stop shop. Your messages here, it's going to send you an email stating that you have a secure message. And so all of this is extremely secure and confidential. And so our nurses can easily communicate with you on here. And so it will show a little red tab over to the right of messages saying how many messages you have. That could be your class excuses. That could be, hey, you've got test results back. We need you to give us a call. So anything that our nurses are trying to get in touch with you or think that you need, they're going to send it through the patient portal, and you will then get an email stating, hey, you have a new message in your portal. You need to log in to see. Also, another quick link up here gives just a map of sort of where we're located and our contact information here. And again, if you need any information or have any questions, please feel free to call the number on the screen there, and we will do our best to help you. Thank you so much for listening, and we can't wait to see you.